The following content is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
To the Everyday Therapy Podcast, where we discuss everyday topics related to your overall emotional health and well-being. I'm Julianne Schroeder.
I'm JC Rader.
I'm Mary Miller.
And I'm Shannon Gavigan.
And we have Whitney Bunch up in the corner over there. And today we are talking about sex. So let's talk about sex, baby. And just a reminder, we are now on iTunes, so please subscribe, rate, and review us. That would really help us out. And you can also, if you're loving this podcast, share it with your friends, and also you can donate to help keep us going. So, yeah, I used to work with Shannon and Mary, so it's so exciting to have you guys here.
It's fun.
Thanks for having us.
Yeah,
thanks for having us.
And I have my own personal experience with kind of learning about my own sexuality and sex through an undergraduate class, Psychology of Sexuality. And it was kind of mind-blowing how my professor could just talk about like the clitoris and the physiology of an orgasm. And I was like, oh my gosh, this makes so much sense. Like I've been seeing it on television and in movies, and people are having sex and it looks so fun, but I don't know how that works.
Right. I think my education was through Cosmopolitan, right? And I was like, wait, how does this work?
Yes, that's like every teen girl's like start.
Right.
Yeah, like super hyper sexual media that we have that doesn't really equate into reality. I feel like.
And I think most of us learn about sex in very obscure ways, not with the facts. A lot of times it comes from playground myth.
I like that.
Locker room jargon.
Yes.
So it's always, so once you get the course in sexuality, and for a lot of people, it is in college, unfortunately.
Yeah.
It should be much sooner. But once you get that information in university, you're like, oh.
Yeah, or from like qualified individuals, right? That have some experience. So speaking of qualified and qualifications, should we introduce our guests a little bit more?
Yes.
Yeah, we got right into it because we're so excited and there's so much to cover, right? But I guess, we would actually like you to share a little bit. Shannon, I know you because we work together, right? But Shannon, share a little bit about yourself and I guess your professional expertise.
Yeah, so I am a LPC, so licensed professional counselor. I'm currently working in a treatment facility for eating disorders, which is a little bit different, but I have background working with individuals in the private practice side with sex therapy. And so currently with the eating disorders, working on how sexuality gets either taken away from them due to their eating disorder, body image issues. So that's currently how I work with sexuality with my clientele.
No, and I'm excited for us to be able to talk about that because I think that's a common complaint for women of like, okay, I'm so worried about how I'm, how they're looking at me, how I'm performing, right? Which really kind of trips up the performance.
Judgment and self-judgment, self-criticism is a huge thing, not only in, the eating disorder population, but like everyone. So
So we'll get into that.
Yeah, for sure.
Yeah.
Mary, can you share a little bit about your training and where you're at?
Yeah, I'm a licensed marriage and family therapist, and so I work with couples and individuals in relationship stuff, and then specifically in sex therapy. So, and I'm working on a certification in sex therapy. I'll be working on it for a while. But,
oh gosh,
that's a long one. It is lengthy.
But I see clients for LifeWorks in both Dallas and Fort Worth.
Okay. Perfect. So tell us, what is sex therapy and what is it not?
Okay, so sex therapy is basically any therapy related to the psychological or emotional or physical aspects of sex.
I love that because, like, I think of sex and I think of like the physical aspect of it.
Right.
Or if
So
you're
much.
a woman, you're going to think about the emotional aspect of it, right?
Well, even as a woman, I think of the physical aspect. But yeah.
No, I'm definitely
Yeah.
playing some
Yeah.
assumptions.
Okay.
Right, right. And that's actually, so I'm glad you brought up gender, because we tend to, I guess, think of sexual constructs in the context of gender, but men also have psychological and emotional relationship with their sexuality as well as the physical. So, yeah.
Yes. No.
And like you brought up the word judgments, and so judgments are part of it, values are part of it, communication. So how that all plays into how we form our constructs of what sexuality means to us, and then how we use that to then have behaviors.
Right.
Yeah. Do y'all have like a set definition of sexuality you like to use? I think people do get a very narrow, like what sexuality is, but what all does it encompass?
It's a great question.
I'm all cheating.
Gosh, I like assumed, like the first thing that came to my mind was like, what doesn't it encompass? Because I feel like that's so much of like, it could be the way we interact with someone, it could be the way we interact with ourselves, it could be what turns people on, what turns people off, it could be music for some people, it could be like so many different things.
Well, there's sexual identity, which is who we are sexually attracted to. And then there's our sexuality, which might be what we're attracted to, or what, or I guess our relationship with sex. So I that's how I kind of think of it. But again,
and then the separate biological sex too.
Right.
Which,
And then there's, and then there's the biological aspects, which is why I said sex therapy really is the therapy that incorporates both the psychological realms, the emotional realms, and the physical realms. All of those.
And how do we create, like, how do people create the constructs of their sexuality?
So a lot of it comes from, I think, how, like, the culture that we currently live in. And then that could be as small as, like, our family friend culture, or it could be as vast as, like, our, American culture, or our, if you live in a different country, that culture. It could be the culture of a certain thing that we like. So, for instance, those who are in the BDSM community, or those who identify with certain desires.
Right. Well, and so culture and social influences are important, but then also, we come here as unique beings, and we bring with us preferences, and there's variety within each of us. We're all different. And so, our sexual constructs do come from our the society we grew up in, the cultural influences, but they also are indicative of just us as humans, and the variation there.
Yeah, and I wonder, I mean, as far as being able to discover your own desires, like how hard is that?
It's hard.
That's why
Yeah.
this is why we have security.
Yeah.
And it's something that's, like, not static either. So, like, you think you may know what your desires are one day, and then it could be something different the next day. And it's not like a one-stop shop. You just figure it out and then you're done. Either. So I think, it is a lot of
One and done.
So think about identity formation in general. So, when I was young, like, I wanted to be punk rock, that was like my identity. And then I was a little older, and then I had that hippie phase. Mainly, I didn't want to shave my legs, so I was like, I'm
I feel that. I get it.
and then I became a mom, so that I incorporated that into my identity. And then I'm a wife, so that is incorporated into my identity. And I was a student, and I'm a therapist. So all those things are part of our identity. Sexuality is like that too. Like we pick up or let go of things as we evolve as humans.
So it can be fluid,
for sure.
Yeah.
pun intended.
And
sorry, was that too soon?
And we were talking before the show about me and Julianne were a little bit nervous to talk about this.
Yes.
I mean, I am still nervous right now.
Yeah, because I flow in and out of this like shame of sexuality because it was never, and it wasn't anybody's fault, but it was never explicitly talked to me about. I remember one of my first sexual experiences, and you had an idea to kind of guide us through.
Well, yeah, so you had your, I don't know what you call it, your little post on Instagram this morning.
Our Insta stories.
And you were talking about today's podcast, and you sounded to me nervous.
Yeah,
and
I was.
I was like, oh, JC doesn't want, maybe she doesn't want to talk about sex. And then what I noticed is that I started to feel nervous and ashamed because I thought, oh my gosh, is there something wrong with me? Because I enjoy this topic.
Yes.
And then I thought about, so Shannon and I are lucky enough to have training with this really brilliant guy, Doug Ron Harvey, and his partner Al, and our instructor Dr. Edita Rusgita. And one of the things they shared with us is that the least comfortable person in the room dictates the conversation around sex. And so
I'm dictating our
conversation.
Sorry, guys.
I was like, oh, she's nervous. And so now I'm nervous. And maybe what does that mean? What are we going to be able to talk about? Oh, I have to be careful because I could sense your discomfort.
And like, how do it and then how censorship then happens out of ourselves of like, oh, gotta cut it out.
Right.
Well, let's talk about the clitoris and all the things.
You just came in strong with clitoris right off the bat.
Wow. Well, no, I think when we think about our mission here at Everyday Therapy is to be able to give permission to people to talk about things. And when we look at the gravity of what sexual shame can do to a person, how it can impact relationships, the concept of self, like it is so necessary. So I am glad we're talking about it, and I'm saying this out loud to myself. So, like, any thoughts about this not being okay? No, it is okay, and it is necessary because we're here to share and help you find out, like, what are your values and, like, how does this work for you? So we're not going to impart any sort of, like, this is how it should be, but help you discover what you need.
Right.
Definitely.
And I would say,
like giving permission to just open the conversation.
Right. Yes. And that's exactly as therapists, and all of us are therapists, that's what we're doing with clients, really. And any therapist can do this. That they don't have to be trained in sex therapy. Any therapist can
have
give
an open
permission,
conversation.
have a conversation. And actually, if we're not comfortable, then we become the least comfortable person in the room, and that's probably not good for clients. So, yeah.
I remember watching one of Shannon's groups at the treatment center that we both worked at, and I think you opened it up with like, here are some words you're going to hear, like vagina, sex, penis. Let's begin.
Yeah, just kind of rip that Band-Aid off. It's like they're words, and the more power we put on them with our own emotions, I think that just really dictates the conversation. So kind of we have to show that it's okay.
Right. And tell me if you all like know this to be different, but I think it's Finland or somewhere where that they start using the anatomical like correct verbiage to educate children about like penis, vagina, like the actual sexual organs. Does that sound legit?
That sounds legit.
I totally buy that. I totally buy that.
And interestingly enough, though, I think what I remember is that their teenage pregnancy rate is also less than because we're talking about it, and
right. So I was reflecting on what JC said, that her first educational experience with sex was in university, and I know a lot of people in Texas get some sex education around 5th, 6th grade, middle school time, but that's about, I don't know,
so
6
crazy.
or 7 years too late,
or even more. I feel
right. So the and I was reflecting on this yesterday because we're having these hearings in Washington D.C. around the Supreme Court justice, and a lot of what we're talking about in the Me Too movement and stuff is all related to sex, but the way to keep our children safe, the way to keep ourselves safe is through education. So the more educated we are, we know statistically the less likely children are to be abused. The teens are more likely to wait to have sex, and the less likely they are to get pregnant. So
I feel like I can personally like relate to that. Like I remember learning about sex through like my first experience was watching Aladdin, and I got tingly during the Jafar Jasmine, scene. Tingly.
Right.
I'll say that. But then I was a little more promiscuous in high school because I wasn't educated, and it was very fear-based, and like just trying to have the experience but not getting anything from it. Do you have a lot of clients talk about that?
Yeah, I would say that I think that is something that with teens, it does seem that there's not a lot of self-reflection when it does come to sex, and it is kind of a reflexive behavior of whatever the culture of your
acceptance
peer
and
group
affirmation,
is doing.
right?
And
That's so
maybe it is curiosity too of like, hey, what is this all about? And so I think that education base, and it goes into young adulthood, middle adulthood, of just self-reflection of what does this mean to me? What do I want out of this? What is this? Does it feel good? Does it not? And I think that's a lot of what the work I find is about.
Yeah, I think.
Don't you?
I don't work with teens, but I work with adults, it's interesting how little they know about their own bodies, and then
Even as adults.
right, even as adults, and then how that leads to expectations about what they are supposed to, how they are supposed to be responding in within the sexual relationship, and then also what their partner is supposed to be doing or how their partner is supposed to be responding, and so and then all the stuff.
Sounds like a
stuff that
lot
comes
of
with that.
assumptions,
Right.
expectations, no communication.
Right.
It's true.
Yeah.
Yeah, we get like a very tiny representation of sex in our culture, and there's no education, or there's so much less about like the internal mental, emotional, psychological side.
Exactly.
And it's our responsibility, right, to learn.
Yeah.
So we can be responsible in making choices and being responsible in making healthy choices for us in healthy relationships, right?
Right.
Well,
Right.
I love, Mary, at some point you had mentioned this before. I've heard you talk so many times about sex, and I love it. Every time I'm like, oh, it's so good. But about responsibility and like you taking your own like ownership in your sexuality, and you asking for what you need and doing what you need. That seems so powerful, because it is easy to like sit there and blame your partner.
Right.
They're not fulfilling you.
Right. And, and I know Shannon's probably had this experience too, because she's worked with couples too. A lot of people have never actually touched their own bodies, and they're looking for something in the sexual encounter. And I mean, most people are looking for an orgasm.
Yeah.
I'm a fan. I think that's cool.
Understandable.
Yeah, understandable. And like, if they don't know how their body works or what it's going to be required to achieve that, but they have this expectation that their partner should know, and then the partner also feels the burden of that. What's wrong with me? I don't know. And as Whitney said, as a culture, the way we educate ourselves around sex actually is kind of sad. Because a lot of it is through either the way we learn information from our friends, or, I mean, frankly, a lot of people watch sexually explicit material, otherwise known as porn.
Thank you.
They see images and they're like, oh, I'm supposed to do that. And,
Yeah.
That's
It
not
kind of
realistic.
turns the purpose into like, I should be sexy, or I should be able to perform, versus like, what do I like, and what is the meaning of this interaction for me?
Right.
And doesn't it seem then kind of like that out-of-body experience, like you're thinking more about how you are performing versus then how you are
Oh yeah,
being,
spectatoring.
Yeah, exactly.
Well, and we're also different. So, like I have a preference. I was thinking about this in relationship to coffee. So I like cream and cinnamon in my coffee. My husband likes a lot of cream, like it doesn't even look like coffee, and he puts a ton of sugar in it, and that tastes good to him. I think it's disgusting, but and actually that's just preference. But that is true for sex. Like
We all
what
have different.
one person really likes is their preference. It's just a preference. It doesn't mean anything, and everybody's preferences can be different.
So we had a question about that, and is that okay to kind of just like answer on that same wavelength? Because one of our listeners' questions was about like BDSM? Is that normal? Is that okay? And I don't know, do we want to get into that, or we can just like bypass that?
Yeah. Can you speak on like what is BDSM and is that
Shannon.
normal?
Well, I think just throwing that word out of the rule book.
Well, what does it stand for?
I know it's
BDSM.
like BDSM. It's the culture of like bondage, domination, submission, and what's the M? I'm just like
Masochism.
Masochism. I was like, oh my gosh, my brain just farted on me.
Sorry. Here, have a drink.
But yeah, I know. So BDSM is normal if the couple finds it normal. So it's about communication and what you find to be satisfying. So if you are a person that finds BDSM satisfying and you find a partner that finds it satisfying, that is an extremely normal, healthy relationship.
Right.
There's consent on both parties,
Right,
and understanding.
Right. So, and the way, so I get questions like and I would say the number one question any person who works in the field of sexuality gets is, am I normal?
Yes.
And there's always one response to that, which is yes. But to kind of frame, because people want to know if their preferences are normal. So the way I approach this, and I mentioned this gentleman earlier, Doug Braun Harvey, in his work, he treats out of control sexual behavior. We're not talking about that, but the foundation of this is what he calls the 6 sex principles. And those are, you talked about one, consent. Consent being, is this okay? Can we do this? Know it, live it, learn it, use it. Consent's important.
And can I say too, I think this is just a reminder for everybody, consent can be okay at one time, and then you can change your mind.
Exactly. Right, exactly. So yes, thank you. And then protection, are you using some kind of birth control or protection against sexually transmitted diseases? Honesty, what is it you were looking for from the sexual encounter, the sexual experience, and are you honest with yourself about that? And then are you honest with the partner you have about that? What is it you're looking for? And then there's values, shared values. What are your values around sex? Is it that you want to explore all things, including BDSM, or is it that your values are sex is just within the context of marriage, and it's you don't bring in things like that, so what are your values around sex? And then is the sexual encounter exploitative because we want things that are non-exploitative, you're not taking advantage of power or of anybody else? And then the I think, is that 11? Did I do 6? Honesty, protection, consent, shared values, pleasure. Oh my gosh.
That's a big one. That's the only one I knew.
For the women listeing, please tune into this.
Don't forget pleasure.
Yes, and actually that is so interesting that I would forget that, and it says so much about us as a culture, because as a culture, most of us get sex education and nobody talks about pleasure. We get the biological aspects, but we don't get this is why we want to do this in the first place, because it feels good. Yeah.
Or pleasure is then like deemed as like dirty.
Right. Yeah, exactly.
Yeah.
Exactly.
I'm wondering, Mary, can you speak a little bit more to the values piece and how you help people figure out their values and like what that looks like?
So that's a good question. How do I do that? How do I do that? I asked them kind of what were the values that were given to them around sex. And so, when we've been talking about that in some form already today, how did we learn about sex, and what were the values that we got from the family we live in, the culture we grew up in, whether it's school or the church or whatever. And then we kind of look at the values that were given, and are those values they still believe in, that they ascribe to? Are they struggling with those values? And is there something about the values that they want to reassess or reevaluate and change? And so that's kind of where I start.
Yeah.
And then affirming whatever it is that they really feel is important to them, no matter what that might be, as long as nobody's being harmed.
Definitely.
It's consensual.
And I think another way to talk about values is, what are the things that would get you in accordance with living in those values with your partner, with yourself, or when it comes to sexuality? And then what would be the things that you're doing that may pull you away from them, right? Like if it's, you know, if you're really into monogamy, but you're, you know, having an affair, how is that fitting into your values, and how could you move towards the things that would put you more into that?
Right. And you know, most people come into therapy because their behavior is incongruent with their values, and it's creating some kind of anxiety. So that's why they're coming in the first place. So it's usually a natural place to kind of start, really.
Yeah.
Yeah. And somebody who's like maybe changing from their values as a child, like family values or cultural, to something that they identify more with as an adult, is that a hard shift to make?
Yeah.
It can be, yeah, for sure.
Okay. I feel like it would be.
Yeah. And I, you
Not
know,
from personal experience or anything.
I don't know about that,
a
but
lot, because so many people get values from family or church. So, you know, I see this a lot in couples. The value they were given around sex is that sex is bad until you're married. And so then they get married, but you know, it's difficult to shake the part of the value that sex was bad. You know, if you've trained yourself to have an aversion to sexual things because it's bad, and now you're married where it's supposed to be great, it's supposed to be okay, it's hard to make that mental shift. So yeah.
Yeah, and I can see it being like, because even if that is a value of yours, like not having sex before marriage, like you can see that in maybe like a positive way,
Right.
but like, and have that shift a little bit smoother.
Right.
Well, but more often than not.
Well, and again, like for me, and I don't want to speak for you, Shannon, but like we're never ascribing what the value is supposed to be, or what is, you know, what we're not imparting our values onto the client. It is our job to affirm the values they have, and so when there is something that's coming up that's creating anxiety for them, it's to explore, you know, what is that, and why is that anxiety there, and then we do look at the values and see how, you know, what is it that they actually want for their life, their sexual life.
Because really it's about encouraging and helping people find their own agency about what it is that kind of is in congruence with them, and like that core sense of self.
Right.
And that's a lot of what the work is having people gain autonomy about, like, this is what I want and not what I think I should want, or like what I've been on this path towards.
Right.
Yeah, which is so hard to tease out, right? Like just in like living, right? Because we want that acceptance.
But it's taking ownership no matter what.
Definitely.
It seems like.
I like the language y'all are using, like it is kind of a microcosm of your identity and your relationship with yourself. Sexuality is just part of that.
Right, exactly.
Yeah. Moving on to something a little bit different, I'm just curious, like we're into mindfulness and obviously the mind as therapists. How does the mind play into sex and sexual experience?
It's a big role. Your brain is like one of your largest sex organs.
I love that.
That's
so
So
funny.
guys, take notes.
Yeah, because I mean, really, your brain is what codes and contexts any sort of touch or thought or feeling or smell, whatever kind of comes into our sensory field. So like, for instance, if I'm touching Julianne on the shoulder here and she's like, oh, Shannon, don't touch me, that's gonna say no. But if I was like a really cute person, it was alone, maybe there's a glass of wine, she might be like, ooh, this feels kind of nice, right? So it kind of codes what, if this is appropriate touch, not appropriate, or smell, or kind of gets the rest of the system going. That tingly feeling you might be describing.
Yes, Jasmine and Jafar.
Yes.
See? and the brain, and this is where there is some gender difference. So for women, you know, we use a lot of our brain, which is cool.
Yes.
But in sex, for women, there is the gas pedal and the brake in terms of sexual desire and sexual arousal. So when we get sexual cues into our environment, into our realm, we are assessing whether or not we want to respond, either with the gas pedal, yes, I dig that, or the brake. So a good example of this, because I see a lot of couples with kids, you know, for if a couple's getting it on whoa, music's playing,
Bound
candles are
chicka-wow-wow.
lit, everything's groovy. And then the mother hears the baby cry down the hall. They just went from gas pedal to, brake, maybe even handbrake. Their brain instantly goes, no, I'm, and sexual arousal stops. So that's the brain's role is, especially for women, so powerful because it can instantly go from gas to brake.
Definitely.
And what is the reasoning for that?
What is the
Like
reason?
evolutionarily, or just, I think it's,
Yeah, I guess, how is it that, if I'm hearing correctly, that men can stay a little bit more in the moment and move through these kind of like everyday sort of like life stressors that would interrupt the moment, whereas women may stop?
I mean, theoretically, it could be based on evolutionary theory.
Yeah,
That could be one theory, is that it's more beneficial for men to have that trait that would have them be more focused on that versus women who might want to take care of the child or
Right.
So being
tend
more
to the home.
relationship oriented in that way.
That could be one theory.
Yeah, I'm not sure exactly why that gender difference exists.
Okay.
There's theories, but
Yeah.
Well,
yeah.
We can look that up. Sorry, I have a curious mind.
Yeah,
right?
that's a good question.
By the way, I know this can happen
think
for men
that-
too.
Yeah.
It's
I think that's just such a cool thing to understand, like the gas pedal and the brake, because I think if you just understand that about your sexuality, that can help you, let go of some of like the shame of how you
Right.
should be.
right, yeah, exactly.
Yeah.
And I'm not saying that it doesn't happen for men, but for women, it's particularly, we have touchy breaks. Let's put it that way.
The conditions
Very
have to
touchy
be
on the
the
brake.
right way.
Yeah, exactly.
And the gas pedal too, right?
Yeah.
Yeah, and I think it's like not all women have the touchier brakes, not all men have the
Right. We're not making
yeah.
that
Well,
assumption.
and I mean, there's more to it. And I'm hesitating to go into too much detail because then it gets a little wonky, sciencey stuff. But there's a great book for women who are curious about this for themselves called "Come as You Are" by Emily Nagoski.
It's such a good book.
She's fantastic. She has a TED Talk too.
Oh, I didn't know that.
And if she ever comes around, I would encourage people to go and see her. She does lecture. So if she ever comes around, go see her. But she does research on the brain and specifically in female arousal and the brain's role in sexual response. And I use some of her work in working with females who are trying to understand their own arousal and response and desire. But her work gets more technical, and if women are looking for that kind of information, it's a really great book, and it can be very empowering for women in terms of discovering their own sexuality.
And I think really normalizing too. It's like I think there's sometimes that question of like why am I not into this, or why is this a problem for me? And I think it really normalizes that sometimes it's kind of biology in a way. Like it's not like you're choosing that. It's something that happens just naturally, and understanding that.
Yeah, and I think taking out the judgment of it, of like there's something wrong with me or something wrong, and having more of that curious mindset, exploring, like, okay, what is going on? Why do I not like this, or why do I really like this?
Right. And and for men, like with my male clients, the brain can interrupt. So for men, performance is so important. Men, and as men age, I have bad news, men. Performance can be challenging because of natural aging, and it's normal. It's normal. But for men, once they have this belief that perhaps they're not going to be able to perform, then the mind gets in the way, and then that fear gets in the way of their ability to perform, their ability to maybe achieve and maintain an erection, their ability to have an orgasm, and so they can also get in their head, and that can be a big break.
Right.
Yeah.
Absolutely. Well, should we
I
talk
think the brain seems like it can be the biggest hang up.
Yeah,
to sex
definitely.
Yes.
as well.
Yeah. And speaking of that, one of our listeners' questions were like, what are some common insecurities? So I think this would be a natural kind of segue into what are the mental emotional blocks in terms of having like a healthy, fulfilling sex life?
Yeah, I think performance is a big one. Am I doing it right? Am I doing it enough? am I making the right sounds? Am I making the right fluid production? Whatever the thing is.
The right sounds. I love it.
Body image is a really big one, of course, for men and women. It's not just women who experience it, but, you know, it could just be the sexual organs themselves, or it could be just different parts of your body. I think those are the main thing. Desire. Do I have the right amount of desire? Do I have too much? Is it weird that my partner doesn't have as much desire? Does that make...
Is that something about me?
Yeah.
Yeah.
Right. Yeah. I think what you said about performance, particularly males who are, so we live in a culture where we don't get enough sleep. We work a lot, we don't have a lot of time devoted to leisure, and so our stress levels are much higher. And stress is the #1 impediment for males in terms of their own arousal, and for women in terms of arousal. So a lot of people come in, and I would say that's one of the primary reasons people, especially couples, seek out sex therapy, is they're not feeling desire or arousal to the level that they would like, and they think there's something wrong with them. So I would say that's #1.
And it all goes back to the brain.
Yeah, it all goes back to the brain.
So being able to manage stress,
Right, right,
Yeah.
in a good way.
right, yeah,
Yeah. Whether that's situational, whether that's long standing.
right. And then I like what you said about the way the body looks. You know, again, pornography has become so easily accessible, and a lot of people use it, and you know, that's great. But the downside of it is that a lot of genitalia is digitally enhanced in pornography. So people have this.
That's interesting. I didn't know that.
Yes.
So they Photoshop
Yes.
that too.
They do Photoshop that. Yes. And so both men and women have a perception about what even their genitals are supposed to look like.
Yeah.
And so clients will come in, is this normal?
Right.
And and I mean, you know, so again, everything kind of goes back to that. Is this normal? Am I normal?
There's a really
There's
great
a lot of
video
diversity.
that Dr. Rosgita, she mentions. It's called porn. It's like a food video. I'm going to butcher the name of it, but it's like using food to describe the difference between like porn genitalia and like hair and all that, like length of time in you know, in any sort of sexual position, and then what actual statistics show. It's a really funny video. It's like food porn video, like differences. It's so funny. I'll try to find the name and send it to you guys.
No,
but
I'm so curious
it's
now.
really interesting, just kind of like you said, the difference between what we perceive. It's almost like a romantic comedy, thinking that that's going to be the way that a relationship is going to be, and then looking at your own and being like, well, why isn't he like
Well,
like hiring a fleet of hot air balloons to tell me he wants to go on a date? Like,
and it's funny too, because like if men and women would talk more about sex, like, you know, some men may have this belief that their female partners, you know, want to go hours and hours with
like just
know,
penetration. Yeah.
And most women would be like,
Please
gee,
stop.
thanks. No thanks. So like, exactly. So if men and women would just talk about
Yeah.
And how do you facilitate that? I feel like that's such a like a
It's
difficult.
such a touchy topic.
Yeah, it's a difficult thing. Why is it so difficult? I don't know.
Well, see, the more relaxed you are, the more relaxed other people are, and the easier the conversation gets. But initially, it is awkward. And so the analogy I use for people is, okay, so I took French in high school. What language did you take?
Espanol.
Espanol. And Shannon, did you take? French.
Oui.
Spanish.
And what did you take? Spanish. Okay.
Spanish.
So have you guys traveled to a country where they spoke the language you
Yes.
took in high school? Okay.
Si.
And so when you're trying to have the conversation, I know this was true for me in Paris, when you're trying to have the conversation, you're so uncomfortable in your head that you're going to say something wrong, you're going to offend the person, you don't really know what you're saying, are you saying, and you're kind of like,
Yo soy estúpido.
right.
You feel embarrassed.
Exactly.
I'm stupid.
And so day one, you're like, oh, and then maybe by day, depending on how long you stay, you know, by day 7, you may be more confident, more comfortable, and even more fluent. So I use that analogy for clients. You know, at first it is awkward. At first it is uncomfortable. But the more we talk about it, the more ease you will have, and you'll relax and kind of be comfortable.
And it seems to me, and you can tell me, sorry, like I think a lot of this evolves around shame, right? So like this idea about even talking about somebody not being unhappy, and to the need to not personalize and go back to preference.
Right,
and so, hey, let's, you know, this isn't not about me not being enough or you not being enough.
Right,
This is about us communicating and learning and being willing to figure it out.
For sure. One of my favorite like psychology terms is like the experiential avoidance. So it's like you're not engaging in any sort of it could be anything because you're afraid of that shame or afraid of that negative emotion that might pop up, and that's really experiential avoidance, is saying that I'm not going to have this conversation, which on the other side of it is I could have a really satisfying sexual relationship or a really satisfying connection with my partner or myself because I'm too fearful of what shame might do to me. What are they going to do if they hear this, or what is this therapist going to think if I say this?
And that's why, like, to me, for therapists and new therapists listening, like, it's so important to ask clients about sex, because as soon as you do that, you show that you're comfortable with the subject and you don't have as much shame around the subject, and it gives the client the permission, and maybe they can feel freer and more relaxed because you're modeling kind of what you just talked about. You're not afraid to talk about it, and it gives them.
Definitely.
And actually, so we were nervous at the beginning of this conversation. So even just checking in with yourself, like, where is your discomfort from where we started this conversation to right now? Has it gone down? Has it diminished? You know, over time.
And humor, like, it's not like, I think
So
we were talking about
serious.
this too. Like I think it's easy to kind of get like buttoned up about it. Like, am I going to know the right terms or whatever? But I don't know, just kind of being real with your clients and having them be real with each other.
Yeah.
That, I don't know, it doesn't have to be so formulaic.
Yeah, absolutely.
And sex is funny.
Yeah, I mean, oh my gosh.
Reminds me of Girls, the HBO show. It's so awkward and
There are
real.
going to be some like very awkward moments, and that can be okay, and you can laugh at it. But I would love to go back to just, I mean, what you were saying, JC, like, how do couples talk about this? And I wonder, because I have a principle or, you know, a way of working with clients on how to approach healthy communication, and I wonder if it translates into the bedroom and talking about this. So knowing that shame is a trigger with sex, right? Like, can it be helpful? Is it advised to say, hey, I really like it when you do this, or, you know, I really appreciate this about you, and I also really like this, and then we can do sandwich feedback, and then go back to, oh, hey, and, you know, once again, like, I so love this about you. Like, is that a helpful principle?
It sounds like being a little bit more positive oriented and talking about the things you like versus like, don't do that.
Right.
Are there other techniques of being able to, and especially, I think when you say men are, you know, afraid of, because performance is such a big issue, not to trigger their shame. Are there ways that you approach that?
Well, I use what you just said, you know, so framing it as an affirmative statement, which is, I like it when, you know, I like it like this, more of that, please.
Yeah, sure. In real time, like, yes, that feels great.
What's interesting, though, from at least my experience with clients, is actually that is like part 2 or 3 of the work, because really the early part of the work is, do you even know what you like? And a lot of, unfortunately, a lot of people don't. They have no idea.
That self-exploration.
So they do know what they don't like, but they don't know what they actually like. And so we start really with their own exploration of themselves before they start giving a lot of direction out, you know, to the partners.
That makes a lot of sense. Moving into, I know we don't have a lot of time left, but talking about, whenever I think of sex therapy, I wonder if some people think of like the Kama Sutra, like sex tips, and you're going to put them in positions and all that jazz. So that's not what it is, right? As we're sitting here talking.
Sometimes we get those phone calls and requests.
Yes.
Do not do that.
Refer out.
Politely declining those. But I'm wondering, like, what are some tips or perspective shifts that you can give to clients or to somebody out there who's like needing a little bit of change, like some average things that you tell people?
So, do you want to start?
Go for it.
You know, I have a list, and you guys, people listening or watching, you can find this on, you can YouTube, or I mean, Google this. You can Google a list of, it has like a ton of different sexual activities.
Okay.
And people can put yes, no, or maybe. Yes, I'd love to do that. No, I'm never doing that. Maybe I might at some point do that. So that's kind of, you know, if they're looking to expand their sexual experience, that's one place, you know, I start. We're lucky in Fort Worth, and I don't know if, I'm trying to remember if they have these in Dallas. In Fort Worth, we have, there's a store, the Velvet Box, and they actually do educational courses where couples can go and
Oh, wow.
learn.
I had no idea.
Yeah. So it's a great date night. So, you know, their courses are like how to give a blowjob, how to perform oral sex. So they have all kinds of classes for both couples and individuals who want to come in and learn some information.
I love that. Yeah.
Get in the curious mindset.
Definitely.
Yeah.
And there's even an app, because words are hard today. There's an app where you can link up with your partner or partners, and it's similar to that questionnaire.
Right.
Like, and it gives feedback to your partner about like, I like this. This is a maybe. This is a definitely not. This is a I'm interested, but and so you both can kind of see what each other's results are.
Working on that foundational principle of consent.
Exactly.
Right.
Exactly.
I'm going to hammer that away.
But I think for me, the biggest thing that I work with, because I do see a lot of individuals in this context, is mindfulness. I know you guys talked about that earlier, but really centering around the key concept of non-judgment of the current moment. So whatever sensations are coming up for you. So for instance, if you are having a sexual desire, not having judgment of what's going on, but then kind of assessing, okay, am I feeling negative about this? Am I feeling positive? And being okay with whatever does come up for you. And then practicing kind of being aware of your senses in the moment. That is so much a part of sexuality, is your five senses. And so, just really kind of getting in touch with the sounds, the smells, the sights, the feeling, and kind of being in the moment, because so much of our brain, again, can take us outside of where we are when we are in a sexual experience.
And for women, and because I work with those with body image issues as well, and Whitney, feel free to tune in, it seems like it would be important, like when there is that judgment about, is he noticing this role or whatever, is to be able to then use that ability to focus in on sensation of, this feels good, right? Or are there any other tips to bring you back to the moment?
Definitely. It's kind of looking at what are the, what's going on that might kind of negate what your judgment thoughts are, right? So is he or she continuing to, have desire for me? That's a clue that they find me desirable, right? Not judging what your fear thoughts are, but looking at the moment of like, they do find me desirable.
Right. And is this, I think I've read something, I want to know like the validity behind this, about like men in particular, like are not going to hone in on the details of a woman. Like when their brain is activated, right? Like that their ability to really see the details is not accessible, right? So that wrinkle, that, stretch mark there, etc. Is that correct?
That's so correct.
Based on most of the clients I see, my husband one time said, most men are just so grateful that any woman wants to take their clothes off in our presence. We're just we don't really.
I think we're so much our own biggest critic that there's.
And that goes back and forth too. So knowing that guys can have body image issues too. Absolutely. Women, we are going to enjoy you if we like you as a person.
Totally.
Right?
Absolutely. And even within that, there is variance, amongst us. We're human, and there's variation. So I think if you're somebody who's feeling really insecure about your body, then it's time to do some reflection and body work. And if your partner is saying things that are making you feel really insecure about your body, it might be time to do some partner work.
Definitely.
We just did an episode on yoga and the breath and all of that. And I know we've talked about the breath and sex before.
Right.
Can you speak a little bit to how you can use the breath during sexual experience?
So if you think about the breath, what I would invite someone to do is the next time they're having a sexual encounter, whether it's alone or with another partner, is to just listen to their breath, just tune into the breath. Your breath changes with your sexual experience, and so tuning into that, and actually tuning into it, can be arousing. You know, listening to your own breath, or even listening to your partner's breath. So but breath helps keep us out of our head and connected to our body. I was actually just listening to something about, and I don't know all the details, but actually women can have orgasms connected to their breath without any touch, which is really
dreaming.
cool.
Yeah.
Dreaming. Right. So your breath can be a real tool to help you not only stay connected to the experience, but also to tell you where you are in the experience, and then to enhance the experience.
Yeah. Seems like a connection to yourself, to the experience, and your partner.
Right.
All in
And
one.
getting out of your head.
Present.
Right.
Yeah.
Hey, I am noticing time. Do we want to get back to some of those questions by the listeners?
Yeah.
Because they had some good ones.
Let's go to the Let's Chat section. Okay, so one of our listeners asked, how do you cope with intimacy issues due to anxiety and anxiety medication? So any ideas on that, ladies?
So I think what I like to do with that is kind of expand the idea of intimacy. There's 5 different realms of intimacy we can think about, like the physical, emotional, spiritual, experiential, and psychological. And so really kind of expanding how you guys are connecting. If, say, there is, if I'm kind of assuming that anxiety medication, it's talking about performance maybe issues.
Well, it's almost like a 2-part question, because it's different with just anxiety and then different with the being on a medication too. So yeah.
So I think it's kind of expanding how you guys can intimately connect, and then also if anxiety is a big piece, how does that person take care of their anxiety through self-care so that they can connect and still feel supported by their partner, that it's not just we need to have like sex, but how can we connect in other ways and then feel supported to, seek out their own self-care.
Yeah.
Yeah, I would use this, I would be approaching it the same way, and I'd be curious about what the anxiety is connected to. A lot of us are expecting a certain experience from the sexual encounter. And so is that what's dictating the anxiety? And so what do we do with expectation or assumptions? And how do we maybe explore, where do we, again, it goes kind of back to values. Where do we get the expectations? And is there a new way to kind of, reframe the experience so that we let go of some of those?
Yeah. And you've told me before, kind of talking about expectations, like one of those big expectations is having an orgasm.
Right. Yeah.
Like we have to have an orgasm every time. And so
anxiety will put that off.
Yeah.
For sure.
Yeah.
Yeah. And, so many couples, and by the way, men and women struggle with orgasm usually at some point in their lifetime during sex. So the thing that's so interesting about it is I'm asking all of you out there to think about when you were, exploring your first encounters that were not sexual intercourse. You didn't know anything about orgasm, but you were just, kissing and, really close to that boyfriend or girlfriend. That's exciting. That feels good. And a lot of times that was satisfying, depending, on what was going on. So the sexual encounter is so much more than the orgasm. It is like all these other things, including just, the look that we give our partner, the things we say to them, but and the connection we have. But it encompasses so much more than the 30 seconds of the orgasm.
Yeah.
Let go of the outcome, focus on the process, right?
Yes.
Because it's even we're talking about like sex and intimacy in the relationship, like what can you get out of that?
Yeah, and even maybe like even if it's not anxiety, if it's something else, like maybe taking orgasm off the table completely and just enjoying each other's touch and looks and
Right, exactly.
kiss,
Yeah.
everything.
Holding hands,
Yeah.
whatever it is.
Oh, that sounds so sweet. Yeah. Okay, cool. Let's see. When should you start talking to your kids about sex?
Immediately.
Yeah. Because it's so developmental. Like, it doesn't have to be just about like
Orgasm.
Yeah, where like parts, orgasming,
Right.
you know, reproduction, but it could just be about like, this is what this is what your part means, or
Right.
this is
Kind of building developmentally.
Right.
exactly, or this is kind of you know, what happens, or like using words that are appropriate for the kids, but then when it's appropriate, start talking about contraception, talking about when you feel ready, when your values, like what they might be around it.
You know, I've raised kids who are now your age. So, you know,
Tell us.
One thing to keep in mind is we are sexual from birth. So we are born sexual. So if a lot of people wait to have the sexual conversation to a certain age, but really
That's so true.
because we are sexual human beings, we're not just human beings who happen to have sex. It's important to have conversations early, and actually it shouldn't be a talk, it should be a dialogue that exists throughout the
dialogue,
child's
yes.
lifetime.
Consistent.
And kids prompt you. You know, they will ask, they notice difference. They notice difference in gender. They notice everything. So they will ask questions, and I encourage parents to take those opportunities to answer the question, answer what they ask. You don't need to go a lot of times into a lot of detail, and then give them information that is, of course, age and developmentally appropriate. I recommend a book, and I cannot remember the author. I wrote it down and then I forgot
We'll
it.
put it in our show
But
notes.
it's called The Sex Wise Parent, and it talks about, again, educating early, and actually education becoming the thing that can help instill your values within your child, but then also help protect your child because they have the information.
And this should be
It makes me think about you saying, as a therapist, you want to present yourself as someone who's comfortable talking about it. So as a parent, I can imagine you would also want to present as the comfortable person the kid can come talk to those things
And it really
to
like
you
go ahead.
about.
Sorry. Yeah, and it really like shows kids that you can have questions about sexuality and your body and what you're seeing or thinking, and it's not shame-inducing.
It's okay.
Yeah, depending on like how the parent might say like, no, don't talk about that, or
and I think developmentally, you know, it should be a two-sided conversation, right? So if they, you know, I don't know, like older teen, like the parents asking, you know, and not just a lecture, is that correct?
Right. Yeah, of course. Yeah.
Okay,
Yeah.
awesome. Well, we have a need to wrap up here soon. Do we have one more question that we can answer succinctly?
Can you really have an emotional, deep connection if you haven't had a great sexual experience with a person?
Yes.
I think that speaks to the first question that we were talking about.
Yes.
Like maybe orgasm isn't the most important thing.
definitely.
Yeah.
There's so many sides to intimacy. Not
Yeah,
just
I like the list that you gave earlier. What was that? Spiritual, emotional?
experiential, psychological, emotional, physical. Did I say them all?
I think so.
That
We
sounds
said them
good.
earlier.
Awesome. Oh my goodness. Well, we can't.
And just
thank
like normalizing again, like sex can be a work in progress among couples.
Yeah.
Yes, you don't have to have it down
Right.
perfectly, and it can change. So, thank you so much for your expertise.
Yes.
I know so many people are going to benefit, and not only your expertise, but your openness, and for helping us to be open about this.
Yes.
Because it matters. It absolutely
sure.
matters. So, real quick, where can we find you?
Go for it.
So you can find me at on the website We Fix Brains. That's for the Lifeology practice. LifeWorks has two names, but and then you can also email me at mmiller@wefixbrains.com.
And I'm currently working at Eating Recovery Center. It's a treatment facility with inpatient and outpatient services. So if an eating disorder is what you're currently struggling with, that is where I am located, and we can talk about sex there.
Cool. Thank you guys so much. And please, again, rate, review, subscribe on iTunes, and share this with other people if you think that it would help them out. And we'll see y'all next week.
Thanks, guys.
Thanks, guys. Yes, thank you.
Bye.
Bye.